Hi, my name is Jonathan Flores, and this is my presentation on the need for universal healthcare, a Texan perspective. This is going to be for Texas politics at the University of Texas at San Antonio. Now, why is healthcare the most important issue for Texas right now? It's mostly due to the COVID-19 pandemic. The total Texas COVID statistics right now, as of April 17th, stand at over 2,800,000 reported cases and over 48,000 reported deaths. The pandemic has basically reinvigorated discussion about the state of healthcare in Texas and nationwide. Now, the importance. Texas has the highest percentage of uninsured residents in the United States, evidenced by the graph here. And we can see that it's not just an issue of population skewing the data, as California, the most populated state in 2019, ranked at 29th in share of individuals without health insurance coverage by state. Now, the main core problems and challenges of Texas healthcare, the main stats are that 56% of uninsured Texans are part of families that include at least one full-time worker. Basically, even though they're working full-time, they're still unable to afford proper healthcare. We can see that 19% of Texans under age 65 are uninsured, and 10% of college graduates in Texas are also uninsured. Now, the solution for these problems, our best solution that we can go with would be us finding a single payer system that works for us, also known as Medicare for All recently. This would reduce the complexity of the current multi-payer system. It would create a baseline of essential medical coverage everyone would have access to, and it would put states on Texas on equal footing with other developed countries who already have universal healthcare plans. Now, the criticism. Many believe that the cost of overhauling the current system would be greater than the savings. And if we look at a more social standpoint, the Texas individualistic / traditionalistic mindset is mostly opposed to such a change. Usually it's expressed in sayings such as, I don't want to pay for somebody else's healthcare bill, or the current way has worked for this long, why do we need to change it? Now, the evidence from a research article supports a counter argument. A research article compared 22 different single payer plans and their cost savings projections, and it found that 86% of these analyses estimated health expenditures that would drop in the first year of implementing them, basically resulting in net savings or less money spent on the healthcare system in total. Long-term savings following that first year were also suggested, so it's not a one-time savings, it's going to accumulate. And the greatest source of savings was the simplified payment administration. And we can see it by this graphic we have here, where we can see the different breakdowns of the savings and the costs. And these are going to be my references. Thank you for taking the time to listen to my presentation.